Thank you for tuning into this presentation. My name is Tauh, and I'm a third-year medical student at the University of Saskatchewan. I'd like to thank Drs. Thorpe, Weiler, Lanassi, and Dr. Darren Nickel for their help in this project. Some legislative background information. With the passing of Bill C-7 in March, the requirement that a person must have reasonably foreseeable death in order to be eligible for medical assistance in dying has been removed. This now allows persons with traumatic spinal cord injuries to be eligible to apply for an assisted death. Some important background information on this patient population. People with a traumatic spinal cord injury report disproportionately higher rates of depression, suicide ideation, and suicide attempts in comparison to other patient populations. For this project, the inclusion criteria were adults living with a TCI at least 5 years post-injury. Semi-structured interviews were conducted using WebEx in the summer of 2020, and the data was analyzed using thematic analysis. There were 10 participants total, with injury levels ranging from C2 to T10 in complete, and data was collected at both Saskatoon and Regina. 4 key themes were identified: accessibility of MAID, timing of access to MAID, hope, and care. In regards to the first theme, participants unanimously expressed support for persons with SCI having access to MAID. However, this was framed with an important contextual discussion. Parts of this discussion include the importance of balancing autonomy and equity, the idea that an SCI injury alone should not be sufficient for eligibility of MAID, and the idea that putting forward something like this runs the risk of devaluing the life of those living with an SCI, and this was kind of under the context of the discussion of ableism. A quote that highlights this first theme: "I think it's so hard because saying SCI patients need that right now somehow makes or tells the world that people with SCI are less than or need to be pitied, or that their life is over. And I don't want people to look at me like that. I'm tired of that ableist view." In regards to the second theme, timing of access to MAID, there was a range of suggestions on what an appropriate timeline would be, with some participants suggesting eligibility would be appropriate within the first year after injury, with others insisting that there should be at least 7 years post-injury before someone is eligible. The variability in an individual's initial response to injury informs the challenge in creating a uniform timeline. Some variables to consider include the age at time of injury, the level of injury, available personal, community, and financial supports, an individual's personal mental health, and most importantly, an access to peer support. In regards to the third theme of hope for a good life or appreciation of life, hope was identified as part of the physical and psychological recovery process and as part of the process of regaining a sense of self or rebuilding an identity. There was also discussion about balancing provision of hope with supplying false hope, and the influence that healthcare providers have through their attitude, connection, and the approach when discussing a prognosis. A quote to highlight hope: "You definitely need hope. Like, even if it's false hope, hope is hope." In regards to the fourth theme of care, participants stressed the need for proper access to care to facilitate reintegration and to support independence. And they highlighted that care needs to be compassionate, comprehensive, affordable, and continuous, meaning it must be provided once an individual is also out of the rehab setting and back in the community. A quote about care: "Having an OT, a PT, a mental health expert visit the home and talk to that person saying, here's what we can do, here's what we can set up. It's kind of like a system that needs to be tweaked based on each person's individual needs and mobility." Thank you so much for listening. Here are some references.